Assalamualaikum. Our group will be present for the subject of PhD 554, Physiotherapy in Gerontology. The objective of this presentation is to describe the physiotherapy intervention for total hip replacement in geriatric patients. The subjective assessment is often undervalued in the assessment and management of a patient. It is the most crucial aspect of the examination as it determines the severity, irritability, and nature of the patient condition. Objective assessment is what the therapist observe, test and measure. The objective result of the reassessment help to determine the process towards functional goals and the effect of the treatment. An outcome measure is a tool used to assess a patient's current status. It may provide a score, an interpretation of result, and at times a risk categorization of the patient. 30-second arm curl test is used to measure the strength of upper limb. The 30-second sit-to-stand test is used to measure the strength of lower limb. But for this patient, is considered invalid because she needs to use minimal support to stand. Erdődy Mobility Scale (EMS) is a scale for assessment of mobility, considering locomotion, balance, and key position changes. The Berg Balance Scale is used to objectively determine a patient's ability to safely balance during a series of predetermined tasks. It is a 14-item list, with each item consisting of 5-point ordinal scale ranging from 0 to 4, with 0 indicating the lowest level of function and 4 the highest level of function. Analysis is the therapist's professional opinion in light of the subjective and objective findings. A prioritized problem list is generated with impairment linked to the Functional Limitation International Classification of Functioning, Disability and Health (ICF) is very useful to determine and prioritize problem lists. So this analysis for these patients are: plan of treatment. The plan of treatment for the first visit is focused on strengthening exercise and gait training. These are the interventions for the patients on the first visit. Patient education: advise patient to do exercise regularly and remind the patients on precaution. In sitting, do not bend head above 90 degrees. Second, do not cross legs when sitting. Third, do not bend body forward to pick up objects. And fourth, do not rotate leg when standing. And these are the intervention for the fourth week. The intervention is focused on strengthening exercise and balance exercise. And this is the intervention on the 8th week, which is focused on balance training, obstacle exercise, and stair climbing. For the evaluation, the therapist will evaluate the effectiveness of the intervention to the patient. On the review, the therapist will plan for the next assessment and progression of treatment according to the patient's level. That's all from our group. Thanks for watching. Assalamualaikum.